To what extent should vaccines be required for all children?
When looking at the futuristic, economical, scientific, and ethical side of vaccinations, we believe that all children should be required to get vaccinated. And to do so, society needs to be educated and support those in need of health care.
Children in society today are becoming ill because of their parents' choice to not vaccinate them. Once eradicated diseases are resurfacing back into society because of the erupting anti-vax movement.
In conclusion, looking at the futuristic, economical, scientific, and ethical sides of vaccinations, we believe that all children should be required to get vaccinated.
Some parents may choose not to vaccinate their children because they believe it may cause them to get an illness in their future. However, consider this: which is more likely, a lightning strike or a severe reaction to a vaccine? A lightning strike occurs 1 in about 15,000, and a severe reaction occurs 1 in a million. By looking at the stats, you can see that a lightning strike is could much more happen than a severe reaction to a vaccine, and therefore you should get vaccinated. Many people may choose not to get vaccinated because they may believe that a vaccine may not be effective or may not help them. However, when looking at the measles, mumps, and rubella vaccine, one in many vaccines, you can see the effectiveness is 93% measles, 97% rubella, and 78% mumps. And therefore, even though it may not be 100% effective, it's better than getting the illness in the future. So looking at the U.S. measles cases, when the vaccine was licensed in 1963, the amount of illnesses drastically decreased. And then when a second dose was recommended, the illnesses were nearly eradicated, and therefore the amount of illnesses in the U.S. drastically decreased due to the vaccines. So 1 in 5 children worldwide lack access to life-saving vaccines, and therefore every 20 seconds a child dies from a vaccine-preventable disease, which is more common in low-income societies because they can't provide the economical support for the vaccines. So with vaccines, 322 million illnesses, 21 million hospitalizations, and 732,000 deaths can be prevented in the near future.
Many families are unaware of the economic options available to them when it comes to vaccinating their children. All children should be vaccinated because it boosts the economy and helps the overall economic situation of a family. The resurgence of vaccine-preventable diseases is due to the widespread failure to vaccinate uninsured and underinsured children. These children come from low-income families, as Brooke has stated before. These parents are not aware of the economic options available to them when it comes to vaccines. 52% of children are covered by private insurance. 34% are covered by public programs. These are uninsured children. The most important program is the VFC, or the Vaccines for Children program. This program gives out vaccines in certain facilities to those who are not covered by their insurance. The remaining 14% of children are underinsured children. This means they have health insurance plans in place, but they do not cover vaccines. Their parents are left to think that there are no other options for them, so they simply do not vaccinate their children due to economical reasons. What they don't know is that they are also covered by the VFC program, but this is never made aware to them by their health insurance groups. So therefore, all children are covered by, in some way, for vaccines, so there is no excuse for their parents not to vaccinate them. In addition, $402 billion in direct costs and $1.5 trillion are saved in societal costs for the economy. This means that the upfront cost of vaccines, or the money that your parents pay to get a vaccine for you, costs less in time and money than it does to get a disease in the future. For example, if a child gets sick by vaccine-preventable disease, their parent has to take off work, which means they lose a paycheck and money for their family. They also are faced with hefty medical bills because of hospital visits or doctor visits. This means that they also lose money once again for their family. Everyday citizens also pay taxes that go into these hospital visits, and this is money out of the pocket of families like yours and mine.
Vaccine immunization has been a highly effective tool for improving the health of U.S. children. Vaccines have played a major role in decreasing the U.S. mortality rate, as Brooke mentioned before. Over 8,000 deaths have been prevented through vaccines. Vaccine immunization has Vaccines have saved more lives than any other medical intervention, including antibiotics and surgery. Majority of parents refuse to vaccinate their children due to the possible side effects. However, only 10 to 15% of medical adverse events reported are due to vaccines. A single case of a vaccine-preventable disease can cause concern in the whole community. By vaccinating your child, you are controlling the overall health of the youth and containing the spread of vaccines. Recent claims of society states that vaccines are the cause of autism. This has pushed majority of parents away from vaccinating their child. However, through medical literature and extra research, these claims have been proven false. Many parents are unaware of the time and research spent into proving a vaccine is safe for usage. Vaccines must undergo a whole unique process and must be approved by many health organizations such as the CDC before being sent off for usage. Hold on. Pediatricians have informed many parents on the safety and effectiveness of vaccines. However, parents still choose to follow their ethical beliefs.
Religious viewpoints have a distinguished effect on society's choices for whether or not to get vaccinated. The religious beliefs of vaccines are that some Catholics believe that they should get vaccinated, but they should be aware of all the health benefits and risks of it. Protestant people believe that an individual has a freedom to believe if they should be vaccinated or not. Jewish parents are strongly urged to vaccinate their healthy children at a time recommended by their pediatricians. Islamic people get vaccinated so that they will protect others from getting sick. And modern Buddhists today generally get vaccinated so that their health is protected. Most of these religious people get vaccinated, however, they should be all aware of the risk. Parents have a huge view on if their child should get vaccinated or not. Most parents get their child vaccinated, but there are some that don't because of what they believe. Some parents think that the vaccines can cause illnesses such as chickenpox, measles, mumps, and whooping cough. Most people believe that children should be vaccinated and that their parents shouldn't have a choice if they want their child to stay healthy. Like Natalie said, pediatricians inform parents on the safety of vaccines and how it is very low risk of an illness. Doctors say that the health benefits of vaccines are high and that the side effects are low. Doctors encourage all children to get vaccinated, but let the parent make the decision after letting them know all the health benefits of the vaccine.
After combining all of our research together, we have come to two overall solutions to the problem. The first is to educate. The first way we need to educate is to require health insurance groups to provide information about other options such as the VFC to gain vaccines for their children. The second way is to require doctors to provide scientific facts about how vaccines work and how it affects the future of our children, as Brooke and Natalie have stated before. They should also provide facts about how autism is not caused as a result of getting your child vaccinated.
Our second solution is that, as well as being educated, society needs to support organizations such as the VFC who look toward the future to ensure children can be vaccinated so they don't contract these illnesses that could ruin their lives and the lives of many others. So people need to take in consideration the number of children who are dying each year and therefore support so that children don't have to suffer any longer.
Some of the limitations to our solutions are that it is hard to reach out to each and every person and to educate them. Health insurance groups have a large number of customers, making it hard to reach out to everyone.
It is hard to gain the support of a whole community, and since not everyone is aware of these public programs, they can't support them. It is difficult to make people vaccinate themselves because not everyone has different backgrounds and different beliefs that may push them away from vaccinating.
This is our future being affected.
Most importantly,
This is the future of our children.
How would you like it to continue?
Thank you.
Okay, a couple of questions for you. I'm going to start with Natalie. What do you think was the strongest counter-argument to the solution or conclusion that your team identified, and why?
our strongest counter was Kirsten's the religious beliefs and the different backgrounds, because that's why many people push away from vaccinating their children because they aren't allowed because of their religious beliefs. and some people just aren't unable to because medical, like history and other things.
Annie, excuse me. In what way did you improve your abilities to work with a group as a result of the project?
So I think this is like one of the very first times I've had a group that actually like we get along so well and we collaborate really well. And so I think just the way that I collaborated with everybody improved because everybody gave 100% effort. So therefore, I gave my all too. So I was really improved in collaborating and combining research together.
Brooke, give one specific way that your thinking changed as a result of learning about Natalie's findings.
So, Natalie brought about the use of scientific elements and how over time, autism, how vaccines can bring about autism. And when I heard about how people are believing that they could get autism, I saw that although I'm looking at the future and how people can be affected, like they could gain autism in the future.
Okay. And then Kirsten, describe how the content of the team presentation was changed as a result of group discussion.
So when we made the presentation and combined all of our research together, we all combined the research and made sure it all went together and flowed and all the connections went together so that we could have a good presentation.